can you tell us a little bit about what Nuance do?
Yes, Nuance is a global organisation, and they provide AI-powered speech solutions to support clinicians with their clinical documentation. You may well have heard of Dragon. Well, Dragon Medical One is Nuance's cloud solution, and over 500,000 clinicians worldwide are creating 300 million patient stories each year.
You just touched on clinical documentation. Can you explain a little bit about why clinical documentation in particular has become such a burden, please?
Yes. Well, over the last 10 to 15 years, medical care has become a lot more complex. Professor Sir Cyril Chandler has quoted that medicine used to be simple, ineffective, and relatively safe. Now it is complex, effective, and potentially dangerous. And what that has led to is a need for much more detailed, comprehensive notes that clinicians are making. And evidence is suggesting that clinicians can spend up to 11 hours per week doing their clinical documentation. Doctors slightly more than nurses and allied health professionals. But if you then throw in the amount of time they're looking for, say, lost notes, duplicating, it can be up to 50% of their time. So that means they're spending much less time with patients, around about 13% of their working week. And that documentation admin burden is adding to the sort of the stress and the burnout that is unfortunately so topical in the healthcare profession today.
So how can digital technology such as speech recognition help relieve the pressure on clinicians, in your opinion?
Yeah, so we speak 3 times faster than we type. And anywhere that a clinician is creating their note, that could be an admission note, it could be a ward round note, it could be a progress note, it could be a procedure note, or it could be in the outpatient department creating their letter. There is an opportunity to use speech recognition as part of that documentation process to reduce that admin burden that they're suffering from today.
And what can you talk to the benefits of using speech recognition in the cloud?
Yeah, so there's a couple of things. By being in the cloud, it allows the clinician to be much more mobile. And by that I mean they have a single profile, it's their profile unique to them, and they can take that to wherever they're doing their work. So they may be on the ward, they may be in the outpatient department, they may be in theatres. That profile goes with you as a result of it being in the cloud. And with providing appropriate security measures that are in place, it can also be accessed from home. The benefit of that means they're not restricted to certain workstations.
And further to that, can you provide any examples where speech recognition has been a success and some of the key benefits perhaps as well, please?
So I've got 2 examples in the acute sector, one in the outpatient department and one in ED. In the outpatient department, the real challenges have been long turnaround times and delays for letters getting to the GPs, high outsourced transcription costs, and often a shortage of secretarial staff, leading to a real backlog of outpatient letters being typed. And clinicians having a huge burden of staying behind after work to get their letters done. So in 2 hospitals where clinicians have actually been creating their outpatient letters using speech recognition, we've seen a number of benefits. First, the turnaround time for the letters has reduced from several weeks down to 2 to 3 days, and that's meeting national targets from the CCGs that the hospitals are needing to meet. Secondly, there's been significant reduction in outsourced transcription costs, and also the backlog that the secretarial staff have had has been greatly reduced, and they've been able to take on more patient-focused activities. When it comes to ED, an independent study that we were involved with has shown that clinicians, when they're creating their note in the ED setting, prefer speech to typing or digital dictation, saving up to about 40% of their time in that documentation process. And that's roughly about 3.5 minutes for each patient. And if you multiply that up for a whole year with all clinicians in the ED department using speech for all their patients, that's around 389 days in a year, which is equivalent to 2 whole-time consultants. As part of the Topple review, which was looking at how the NHS workforce was getting ready for digital, they took a slightly more conservative estimate where they looked at saving times of 1 minute per document creation. And in the outpatient department, that was saving about 1 million hours of consultation time, which is really quite significant. Those 2 examples are in the acute. We've also seen similar examples in the community setting, in mental health, and finally in primary care.
That's great news, I think. And something that we've heard more about is using speech recognition as a platform for other AI-embedded speech solutions. Can you unpick that and give us a bit more information about how that works?
So once you've got speech as the foundation for the way clinicians create their document, then natural language processing, and we call that clinical language understanding, that can work in the background and produce a number of tools that support the clinician. It can help them improve the specificity or the actual detail of their clinical terms. It can play a role in identifying possible missed diagnoses. And it can also allow the clinician to SNOMED CT code at the same time they're doing their clinical documentation. I call sort of SNOMED CT coding on the fly. But it also can allow clinicians to access knowledge databases for evidence, such as UpToDate, such as BMJ's best practice, another tool from Elsevier, for example. So it's allowing clinicians to have real-time access to tools as they do their note. And then you come on to the concept of virtual assistants, where I'm interacting with the electronic patient record using my voice, whereas I might say, for example, show me the latest ultrasound scan, or show me the latest report of the most recent MRI scan. And so it's taking the clicks away that the clinician would be doing, navigating a way around the EPR and thus saving time.
Sounds so exciting. Can you finally just touch on some of the things that you're looking to in the future? What does the future hold for Nuance?
So I think one of the key opportunities is for the doctor and the patient to interact much more personally without the doctor hunched over the computer entering the data. It's something called ambient clinical intelligence. We're bringing all the AI-powered speech technologies together and having bringing that together in one conversation. So, for example, voice biometrics allows the clinician to sign on by using his voice. My voice is my password. Then the whole conversation between the patient and the doctor is diarized. And then natural language processing is then picking out the key clinical terms and putting those into a structured note. The same structured note that the clinician would have done anyway, but it's happening automatically in the background. Those clinical terms are SNOMED CT coded, and at the end of that interaction between the patient and the doctor, there've been no clicks, there's been no hunching over the keyboard, and the interaction between the patient and the doctor has been a much more personal one for both parties.